Remember to subscribe and hit the bell icon to never miss an update from iMumz.
Hi, mommies. So, you finally delivered your bouncing bundle of joy. Your family is ecstatic, you are relieved, and things are relaxed. Now, you want to get back to your normal routine work, chores, regular activities. But wait, let it take time. Take it easy. Your recovery postpartum cannot happen in a few days. In fact, a full recovery from delivery can take months. I, Dr. Anita Chaudhary from the holy city of Kashi, will tell you how to take your journey forward. While you will begin to feel normal in about 6 to 8 weeks, it does take a longer time to heal completely. What you can see outside is just minuscule. There are lots of changes happening inside. Postpartum period is 6-week period post delivery. This is a very delicate time for you, the mother, the baby, and the members of the family. Slowly adjust to the fact that you are a mother now and a responsible mother. There is a certain rhythm that needs to fall in place. Discover it, firm it up, and adjust it in such a way that it works for you and for your baby and your entire family. This is what you need to do postpartum. Get plenty of rest. Sleep as much as you can. Take your time as you cope with the fatigue and tiredness. Sleep when the baby sleeps. Take the help of people around you. Don't hesitate. People around you are your own people, your own family and friends. Food is extremely important. Maintain a healthy diet consisting of proteins and carbohydrates. Fats are also important. Eat in time and follow the same time every day. Ensure you are having fiber-rich foods like whole grains, vegetables, and fruits. If you have constipation, use stool softeners to ensure a regular bowel movement and avoid any straining. This is not good if you have had any perineal tears or a cesarean section. Good bowel will actually help your digestion as well. As your recovery progresses, do begin to walk, exercise, and even simple yoga can be done, but remember to consult your doctor. Don't overdo it, but definitely do not ignore it also, because health is wealth and you have to start slowly, little by little every day. Here are a few things that you are advised not to do during this period. We get a lot of do's, but what you don't have to do, that I will tell you. Do not insert anything in your vagina. Based on the kind of delivery you have had, you'll be surprised at the kind of changes that have happened in your vagina. It includes the stress, the stretching, and the bleeding. You may feel you're back to normal and you want to resume your normal activities like sex or using tampons. But do wait till your doctor approves these activities. The important thing is the risk of infection. Your uterus would still be healing post-delivery. It takes about 6 to 8 weeks for the uterus to come back to its normal size. And if you have had a vaginal delivery, that region would be healing too. It is advised not to use any internal devices such as menstrual cups or tampons, considering that there could be an infection on these wounds. Usually, bleeding post-birth lasts for about 6 weeks. It does change color from red to brown to pink to clear. So this is the best time when you should use pads, and remember to change them frequently and wash your hands to prevent infections. As for resuming sex, doctors may recommend waiting for up to 6 weeks after delivery. So take it slow, be comfortable, and see how you are feeling physically and mentally, and in consultation with your doctor. Do not overexert yourself. Of course, you want to do the best for your baby. Feeding, changing diapers, cleaning, and all this will definitely disturb your sleep. Remember to take rest and recharge yourself. If you stress yourself too much, you might bleed, cause muscle strain, and suffer from anxiety. Take it easy, my girls. Do only what you can. Walk gently and do not exercise heavily. Stop exercising if you feel pain, and remember, rest to the maximum. If there is pain, please consult your doctor. Women can have some pain after delivery, but the duration could vary. The usual causes of pain could be cramping as a result of the uterus shrinking to its previous size, the pre-delivery size. And sometimes this pain could be very, very uncomfortable. Pain between the vagina and the anus. Pain in the region of the incision and sutures. Pain or stiffness in the neck, back, and the joints. Pain due to swelling of breasts. It is advisable to see the doctor if you have any of these symptoms. A headache. The commonest cause of headache could be lack of sleep. Second thing is dehydration. A borderline dehydration is also a cause of headache. A headache that cannot be addressed with simple medication and it affects your vision, you have to consult a doctor. Pain and fever over 100 degrees Fahrenheit, pain while passing urine, if you have heavy bleeding, pain in a specific region of the breast with reddishness or fever, a foul smelly discharge, pain along with the swelling in the legs, difficulty in breathing. Do speak with your doctor who will examine you and then recommend medicine. Do not ignore if you're feeling depressed, if you're feeling sad or anxious or stressed in the first 14 days postpartum. Speak to your doctor, please. Remember, you are not alone. Many women go through these symptoms and you must be checked for postpartum depression. Symptoms could include crying, anger, feeling withdrawn and not willing to interact with others or feeling positive or even not taking care of your baby. Don't fail to use birth control. This is something so important. Remember, you could get pregnant after 6 to 8 weeks post-delivery, and I have seen such cases in my practice. Do consult your doctor for birth control, and there are a number of options available like intrauterine devices. There could be birth control implants, birth control injections, birth control pills, sterilization, and if your husband is willing to use condoms, is one of the best and the safest thing to do. Stop smoking and drug usage. This goes for you and for your husband. If your partner is a smoker, get him to quit immediately because smoking damages your health, and the second-hand smoke is a key factor for SIDS syndrome, that is sudden infant death syndrome. Smoking could also cause asthma and other respiratory problems in babies. I want you to be happy. I want your child to be healthy. And remember, a healthy, happy family will create a happy, healthy next generation. And very important, remember the first few months post-delivery is the period of learning for you and your entire family. Take it easy and adjust slowly as your new life falls into a routine. Enjoy the experience without stressing yourself too much and just be mindful and aware. Your little one knows nothing, it just knows you. So whatever emotions, whatever feelings you have will be transferred to the baby directly and through your milk as well. So stay happy and take care of yourself and your baby and your entire family. Thank you and namaste.